All right, good evening and welcome to another Saturday night conversation here on the Tobago Inspirational Network. This evening promises to be extremely informative. We have two individuals on the panel who are highly qualified and experienced, and they will be able to speak to this topic in detail. This evening, we are talking about COVID-19, the coronavirus disease, and we will be talking as much as we can about what it is and how it impacts you, how you could avoid um, being affected or infected by this deadly disease, and all that you need to know. And of course, you will be given an opportunity to ask your questions along the way. We have with us this evening two folks who are both from Tobago. And the first one, no stranger, this is Dr. Brebner, Dr. Faith. Well, no longer Brebner. I'm so accustomed to saying that. Sorry, Dr. Faith B.Yisrael. She is a social scientist whose focus is health education, program development, and implementation. She is the chairperson of the Imani Bet Kenneset Foundation, an NGO that provides health and wellness opportunities for special communities. She holds a Bachelor of Science degree in neuroscience, a Master of Public Health degree, and a Doctor of Public Health degree in Behavioral Community Health Sciences. So, good evening, Dr. Brebner, and welcome to the program.
Good evening, and thank you so much for having me.
And forgive me if I keep saying Dr. Brebner. It's
That's
there.
fine. That's okay.
I'll get it right somewhere along the way. So, my apologies. All right, and this gentleman is also no stranger to television and no stranger to Tobago. Dr. Maxwell Adeyemi, and if I could put a little plug in there, when I'm in Tobago, he's my family physician. He specializes in family medicine and diabetology, and got that initial qualification in Nigeria, Lagos, Nigeria. Of course, he is family medicine and primary care. He was further qualified in that at the University of the West Indies in Trinidad, and he has a diploma in diabetology from Wales in the United Kingdom and a master's in public health from London. And of course, he is a member of the Caribbean College of Family Physicians. And Dr. Max, good evening and welcome.
Thank you, Cadell. Nice to be here.
So we're talking about this coronavirus disease, and I was browsing some figures today, and I realized that let me just, for the folks who are in Guyana, the total number of cases in Guyana as of today is 1,459. That's positive confirmed cases. 921 patients have recovered. 46 deaths in Guyana so far, and 43 new cases today. And in Trinidad and Tobago, 2,230 cases, as the latest figures that I have, 717 recovered, and 33 deaths. And in Trinidad and Tobago today alone, I understand it's 182 cases, new cases. I stand corrected if that figure is slightly off, but that's the information that I have. And worldwide, there have been 26.6 million cases, 17.7 million recovered, and 875,000 deaths. I mean, that's a telling situation. It says that this thing is not something that we should play with. It's not something we should joke with. But let me start with you, Dr. Max. Tell us about what really is this COVID-19? What is the coronavirus disease? We've been hearing a lot of things, a lot of theories about what this virus is and all of that. Tell us from a medical standpoint, what is this coronavirus?
Well, good evening, everyone. Well, we know coronavirus is one of those family of the coronavirus species. There are quite a few of them that have been identified over the past decades. The recent one, which is the COVID-19, which came into existence or was given that name sometime in December 2019 when an outbreak occurred in Wuhan in China. Coronavirus is just a species of viruses that normally do not affect or do not reside in man, but now they jump from animal into man. So there are quite a few of them. You have the MERS and that's the Middle East virus, and you also have the SARS virus. Those are families of the same viruses, and they've been around for a very long time. They are called corona because of the shape of the virus. They're like a crown with some spikes on them, like a crown, basically. So that's where the name come from. So coronavirus has been with us for a while, and but this latest version, which started, the pandemic, is a new strain that just came in, and because it's new, the human species has not gotten any kind of immunity or any kind of defense against it, and therefore, until we're able to acquire that, either through herd immunity or antibody response or vaccine, we will have to battle with it. It started, like I said, in December and 2019 in China, and from there, it's moved practically all across the globe. Every part of the continent is not affected, and that is why the WHO has declared it a pandemic. And that's basically an infection, outbreak of infection in very large proportion that affect practically every part of the world. Just to put a layman term or terminology for being classified as a pandemic. So it's no longer a specific area, but global.
Let me bring in Dr. Brebner there. As Dr. Max was saying, when we remember hearing about this coronavirus disease initially, we many, including myself, brushed it aside and just figured, this is something that's happening in a remote part of China, has nothing to do with me really, until we realized that it was spreading rapidly, and many of us still did not take it seriously until probably it got to the US, and then we realized, well, if it's in the US, it's not going to be far from us, and until it got to our respective countries and we started paying, then many people started paying specific attention to it. From a public health perspective, how does something move from a remote part of Asia, of a country in Asia, and get to almost every single country in this world? How does that happen?
Well, I think what we are seeing is really the effect of globalization. The fact that we've become a single world where people can move from one area to the other within a couple of hours. See, many years ago, we did not have that option. Many years ago, it took days and weeks and months to move from one continent to the next. But we are in a situation now where you're moving from one continent to the next within 24 hours. And because this is a virus that is living within us and that seems to be spreading relatively easily due to droplets and so forth, it means that once you have it inside of you and you jump on a plane or jump in a boat to go to another country, you have it. Now, the thing about it too is that because so many people thought that it was not going to be as serious as it is, many countries did not feel the need to take the necessary precautions to stop travel, because we are seeing now what stopping travel does. It's not just a public health issue, it's now an economic issue that we have to deal with. So it's just one of those things that, you're right, we didn't pay much attention to it at first. We thought it was just one of those things that was happening way out there, so we didn't have to worry about it. And because of that, people kept getting onto planes and boats and kept moving, and therefore the virus moved.
What now that we know more about this virus, I mean, I move around sometimes and I'm still amazed. There's a particular part of the country I go and I'm seeing guys playing football and cricket. I'm seeing people at bars trying to still get in some drinks. I mean, even though we understand the severity of the issue now, it's in our backyards. We're seeing the numbers climbing, but there's still people who are defiant, and still people who believe that this thing is not going to get to me. Why do you think this is still so? Is it a matter of education, of not being enough public education? Is it that people are just too casual and complacent? How do you explain that? What is happening?
So I think what you're saying is just human nature. There was an initial thought in public health that education alone causes people to act correctly. But we've proven that to be inaccurate because education alone does not cause us to exercise, even though we know we should be exercising, how many times a week. Education alone does not cause us to eat the correct foods, even though we know the foods that we should be eating and so forth. So I think it's all part of human nature. We also have a group of people who simply don't believe that what is told to us by the government and by WHO and so forth is accurate. You still hear all of these conspiracy theories out there about whether the virus is real and whether this is a hoax and so forth. So even though we assume that the information is there, and a lot of us have the information alone does not necessarily translate to action, does not necessarily translate to us doing everything that we need to do, because we are human beings we normally do what we normally do. We normally go out, we normally lie. We are social beings, we interact with each other. And it's very difficult to tell human beings who've been doing that for all of their lives that they now cannot do that because of this thing. This thing that you don't see. You see the memes about if you were actually able to see the virus out there, you would probably act differently. But we are not seeing it. And it's hard for humans to conceptualize this thing that we are not seeing, that we are hearing about, that some of us still don't believe. And you're telling me that my life has to change drastically because of it. Human nature does not allow us to make those heaps and bounds as quickly as we think we should. That is just the issue with public health, unfortunately.
No. Dr. Max, let's talk a little bit more about the virus in itself. We know that we're told, as Dr. Bremner mentioned, it can be spread from person to person, and we're advised to wear masks. But there's a lot of contention still about the use of masks, whether we should really be using masks, whether you should be using masks in a tropical climate, and all of that. We've been seeing those arguments popping up on social media and the regular media as well. Tell us a little bit about that in terms of how can we mitigate the spread of this virus and how effective it is to use those face masks. And we've heard a lot about washing hands. How does that affect the spread of this virus?
Well, basically, the procedure, the stuff that we need to do to prevent the spread of the virus is, one, safe hygiene, which involves your hand washing, not touching your face, and minimizing your risk of infection in terms of places that you go to. The other one is the face mask. Now, there's been a lot of, argument for or against, some out of ignorance, some out of utter rebellion, and some out of, I would say, sometimes stupidity sometimes. The fact is, it's been proven most of the countries that had earlier success, like Norway and Sweden and the other thing, the fight against COVID, or China or Korea, they used masks as one of the major tools in curbing the infection, because the mask just reduces your ability not only to spread the infection to somebody, but for somebody else spreading to you as well. Okay, so it is not about you alone, it's about you protecting somebody else in the use of the mask. And people have been arguing about this mask thing, and some want to say where it's choking them, is this, is that. A typical doctor wears mask every day in theater, every day. Sometimes for about like 4 hours in an operation. Sometimes operation lasts 5 hours, 6 hours. They ain't drop dead in theater. They didn't choke to death. And we accept that as normal. If tomorrow you're going to do a surgery and you heard that the surgeon who is doing your surgery neither put on a scrub nor put on a mask, you will get livid, because you know the consequence of that, that there's a risk that the person poses to you,
Mm-hmm.
either from sweating and the sweat dropping on you, or when they talk, the saliva gets into your open abdomen if you're doing an abdominal surgery, or their contaminated hand, touches something. We know the risk of that. So it's very easy for us to, import that into our argument. If it could be done to reduce infection in theater, it could be done to reduce infection just in the outside. So wearing mask is just one of the tools that we use to protect ourselves and protect other persons from getting the infection. Some of the
Uh,
arguments that people are making are a little bit not scientific, that they say the mask will reduce your oxygen saturation and all the other thing. That is not correct, because if that is
we
the
have a
case,
we
if
have a
that is the
comment
case,
here that,
yeah,
sorry,
sure.
I want us to just look at this comment. Well, it's the same person, but three comments. They were saying that, well, apparently there was a press conference today, and people weren't. Whoever had did the press conference was not wearing the mask. And then they went on to, let's see if I get the next comment right. Said I really cannot breathe in the mask, and I have constant chest pains. And the last one was that, sorry, there needs to be a clear indication of what constitutes a mask. All right. So I don't know if you want to touch
All
that
right,
quickly up.
that person may have a point, because it's not every person that may be able to wear mask. There are some medical indications that may exempt you or may make it difficult for you to wear mask. Okay, if you're an asthmatic, if you have what we call chronic obstructive airway disease, people like pulmonary fibrosis and other things, medical situations that may warrant that you'll be excused from wearing mask. Those are understandable, and the medical person may be able to analyze that situation and say, okay, where you could exempt this person from mask. But the risk of not wearing a mask in those persons when they are outside and they are exposed to other things, other persons who may have it, they increase their risks as well. Now, everybody may not be able to wear the same type of mask, and because the masks are not standardized, I understand that person's point of view. There is no standardized, because the surgical masks are different from the N95 masks, they are different from the cloth mask, and there's no standard for that. I think maybe that is where the argument to go in terms of how do we find a standardized mask. But the surgical mask is pretty effective. It works well in theater, it works well in the hospital, and I think it could work well as well. The N95 is okay. And when you start wearing the mask after a while, you may feel, you get used to it, you get comfortable with it. I do understand that people may have limitation and some level of tolerance might be different. I respect that, but it's still not an excuse to not wear mask for a few 1 hour or half an hour, that you might go out and come back in, okay, and do what you have to do, and then come back in if you don't have to be exposing yourself unnecessarily.
But there's some people, and I see it a lot. People go out. Well, I know now there's the new law in Trinidad and Tobago, but people go out to exercise, and the concept is that if I am not going to be interacting with somebody within a space, then I don't need to wear a mask. So, for example, you would see somebody walking along the road, and when they're about to go into a building, they take the mask out of their pockets and put it on and go in the building. Is that okay, or is that dangerous?
If you're not in a crowd, really, I don't think it's much of a big deal. All right. However, if you are in close proximity with people, because this virus, we're learning about it every day, there are postulations that the virus may be in air for some amount of time. So if it's somebody coughing in your face and you pass coughing out, and you pass within 2-3 seconds or 2-3 minutes after that, and the virus is in the air, you may contract it. However, contracting the virus too has its own the parameters. Okay, the length of exposure, the volume or the quantity of the virus, and there's so many other things that may determine if you get it. So just getting out of your car and then putting on your mask and walking across, I don't think that is much of a huge risk per se. So the risks are stratified in terms of what is low risk, what is medium risk, and what is high risk. Okay, so we need to gauge what risk we are in. If you are in a room with about 20 people, and obviously, you know, the risk there will be much higher than if you just walking past somebody, okay, and you put on your mask before you enter a building. Yeah, so we have to stratify the levels of risk based on exposure and what other things obtains and the spaces that we're in. That's why they say you limit your exposure to this amount of people or this number of people in this particular kind of space.
All right. Let me come back to you, Dr. Brebner. I know that there was a conversation earlier this week on Facebook. I think you were a part of that conversation. Talking about businesses maybe limiting the number of people that can come in, let's say 5 at a time. And the resultant impact of that really is that you have a long line of people congregating outside in some cases, or there's a rush. How could that situation, do you believe that situation could be better managed so that we can, reduce, because that's the target, to reduce the possible spread of this virus?
Right. So the aim really of everything that we're doing is to reduce your level of risk. So you have to think about very carefully what you're doing and whether that actually reduces your level of risk. When we're talking about businesses have been doing several things. One, limiting the number of people inside of the businesses. And that's important because you don't need to have people who are too close to each other. Again, going back to that 6 feet, which is at least 6 feet guide, because that is what we think somebody who speaks normally, the amount of droplets that come out of your mouth, how far those droplets can move in the air and that kind of thing, that is a kind of a safe distance to stay. So if you have a limited space, obviously you need to limit the number of people who are in the space. But again, you have to look at your overall risk for you, for your workers, and for your patrons. So if you have a situation where you are limiting the number of people on the inside of your building, but you are not controlling how those people congregate outside, we are seeing where you could still end up with increasing your risk because somebody outside may be congregating in a group, not social distancing, not staying at least 6 feet away from each other, because they're together, because they're out there for a long time, because you now have to think about the fact that because you have those limits, the amount of time the person spends standing outside in the group is now increased. That you now have a situation where everyone outside is now at a greater risk because of the measures that you put on the inside. So again, businesses need to really think through everything that is done. If you are having limits on the number of people who can come inside, I am thinking you may have to consider expanding the amount of time that your business opens, ensuring that you have measures outside so that people can social distance. Think about the fact that we are in Trinidad and Tobago and the sun seems to be getting hotter and hotter every day. So I have seen businesses, for example, put up tents on the outside so that even though people are standing up in a line far away from each other, they are relatively comfortable. Because you have to think about all of these factors when people decide to behave a certain way. Again, we are going back to a culture where we are used to being close to each other. We are used to standing next to each other. We are used to talking to each other. So that is why even having the little markers on the ground that says stand here is really an important public health mechanism to cue people into thinking, okay, this is what I need to do. It's not what I normally do, but this is what I need to do at this time so that we can control the situation that we're having. So one, if you could expand the amount of time that the business is open, that would be wonderful. If you could expand the number of actual businesses, because I have seen, for example, the first go around when we were closing down, I have seen banks move from having 3 or 4 outlets to limiting it to 1. And in my mind, I'm thinking, why would you do that? You don't want a situation where you're forcing 100 people to come to one location when they normally would have gone to four, have 25 people go to 4 locations. So again, you have to think through what we're doing to ensure that the ultimate risk is reduced when you are looking at it. Of course, if you have a very small business, that may not be an option for you. And you now have to think about what you can do as a small business versus what a bank or a big credit union or some, another business like that can do.
I want to throw at you, Dr. B.Yisrael, a tricky question. And it really has to do with schools and educational institutions. I know that many governments, including Trinidad and Tobago, have announced that they will stall the reopening of schools and so forth. But of course, that can't be done permanently, and we don't know how long this virus is going to be around. Um, how do you recommend the government or in any, not just Trinidad and Tobago, Guyana or any other in the Caribbean, treat with this issue of students going back to school?
Well, the issue with students being physically in school is really not much about the students themselves, because what we've discovered so far is that younger people tend not to have as severe responses to being infected with the virus. So the issue is not about the child. The issue is about the fact that the child can come in school, pick up COVID-19 and go home to the grandmother. And it is the grandmother who has heart disease and diabetes and probably cancer and everything else that now has a very severe response to having COVID-19. So again, it goes back to balancing the entire risk for the entire community and not necessarily just the risk for children. We are in a world now where being online is the way to be. I know people who live in Tobago and work in other countries hundreds and thousands of miles away. That is just the way it is. So I think this is actually forcing Trinidad and Tobago and forcing all other Caribbean islands really to rethink how we do so many things, because we have really been behind the curve as it relates to a lot of this stuff. So what the government needs to do includes ensuring that we have access to the online services so that kids have access to internet and to computers and so forth. What we would also need to do is to rethink what we do in a classroom every day. Rethink how much time we spend, quote unquote, teaching, because there's no way you could get a 5, 6, 10, 15-year-old to sit for 8 hours in front of a laptop interacting. So it means that the entire teaching process, we need to rethink how we do teaching. But it's also an opportunity for us to then expand how we teach and what we teach. Now, for example, I was part of a Zoom meeting for a very short period today with a friend of mine who is based in New York, who is teaching coding to children in Trinidad and Tobago. And that is an opportunity that those children may not have had if we were not in a situation where they were not sitting in a classroom all day, every day, or 5 days a week. So again, we have to look at the pros and the cons, and we have to look at how we can make the best of the situation that we currently have.
All right, Dr. Max, let me bring you back in and let's talk a little bit more about this virus. In I don't know the specific percentage in Trinidad and Tobago, but I know I heard up to today, I believe in Guyana, it's 40 to 50% of the positive cases are asymptomatic. What are the implications of that? I know Dr. B.Yisrael mentioned that in passing not too long ago, but what are the implications of a high level of asymptomatic cases, such as that 40 to 50%?
Well, basically, if you have an asymptomatic kind of scenario, remember some of the asymptomatic cases can also spread the virus. And that is the danger in that. Okay, they're not having symptoms, they look fine, they don't even see the need to get tested because they're not showing any symptoms, and they are interacting with other categories of persons, young, old, job, colleagues, you know, and the risk is there that these folks will continue to spread the virus, and that is where the danger lies. I'm not too certain about the percentage that we have in Trinidad and Tobago right now, but generally, close to 80 to 90% of the people who have COVID really don't show severe symptoms. And it is the 10 to 15% of them who really have very bad reactions to it that may increase their morbidity and mortality. So most other people will also recover. Those who have symptoms, they will recover, and there's also another phenomenon that people who recover will still have situation where at least 3 cases have been reported so far where there's a reinfection. One in North America, there's another one in either China or Korea and some other place. Okay, and when this happens, obviously they are under the false hope that okay, yes, I've gotten COVID and I've recovered, but then they get reinfected, and then there could be a problem again.
But how do you explain this variance in reaction, or how people are affected? Somebody would have the virus, not even know, and somebody else dies. What is
Well,
responsible?
basically, that's just how viruses behave generally, or any disease at all. Everybody don't have the same level of immunity. Everybody don't have the same level of body response. Some will have exaggerated responses. Like the 3 of us online, and we could get the virus, maybe just the common flu, and I get sick for a day or two, and I'm okay. And then Dr. Brebner gets sick and she's off work for a whole week.
Yeah.
And then Kodet gets sick and she gets pneumonia and is hospitalized. So everybody have different, body reaction depending on the state of your body, the state of your immune system, and also how your body will react to the virus. And there's so many other things in your body function that may affect how somebody, will respond. So it generally across the board with most viruses, be it H1N1, be it normal seasonal flu or whatever influenza or COVID, it doesn't matter. We all have different body responses based on our body composition, body immunity, and our body responses.
But Koda, can I
Go
jump in
ahead.
there, particularly with the question from before in terms of asymptomatic people? That's one of the reasons most places are stressing using a face mask, even if you don't use the N95 or the surgical mask. It is because of this fact that there are people who are asymptomatic, but they can still spread the virus. And the mask really is just one of the many mechanisms that we are trying to use again, because this thing is so new, because this version of the virus is so new and we're still learning so much about it. Because we were really all hoping that once you get it, like so many other infections, once you get it, you never get it again. That would be wonderful. But we are recognizing that that may not necessarily be the case. And because this virus is so new, we are not really going to be able to answer so many of these questions for another year and a half, 2 years. We simply don't know the answer. So, and because we are in such a space of unknown, the idea really is to protect us as much as possible, because we really just don't know. That is the issue with this. We really just don't know. So we are trying to protect as many people as possible until we learn more about this, until we have more definitive answers about how the virus works, how our body reacts, whether even, we're talking about vaccines and all of that, whether the vaccines would even work. And all of those things are critical. You had mentioned before that they need to sanitize, and that is something that I would jump in quickly with here, because another thing that I mentioned, or another thing that I commented on this week or maybe last week, is the fact that many of the businesses that we are seeing, even though they have the soap and water, so they're telling you to wash your hands and so forth before you come into the business, they are watering down the soap so much that the soap is no longer functioning as soap. and,
Wow.
and it's critical to understand that the soap has to actually lather, and the soap has to actually behave like soap for it to work. So you are trying, as a business, for example, you are trying to save money, to cost cut by watering down your liquid soap, when in fact that is defeating the purpose of the soap and water in the first place. In a situation like that, I've been telling people, even though it may seem to be gross and it may seem to be ooey, it's actually better if you just use a regular bar of soap. Get a regular blue soap. That is the cheapest soap ever. ensure that the soap keeps getting rinsed out, or if you're about to use the soap, rinse it out before you use it, and use a regular bar of soap. And don't even worry too much about the liquid soap, because that can be very expensive, and we don't want you to be in a situation where you're trying to cut costs and then ultimately increase the risk of the population because you're watering down the soap.
Right. Basically, just in addition to what you're saying there, the mechanism by which the soap actually deactivates or kills the virus is what is important for people to understand. That the virus functions with a protein, okay, a lipoprotein, that the soap, by way of chemical reaction, will dissolve that that component of it and make the virus inactive and practically non-viable. Therefore, if you water down the process of getting that chemical reaction to take place within the soap and the virus, then you would defeat the intention of eliminating the virus through hand washing.
Yeah.
Dr. Bram, I want to come back to you with this question, because there are some people who avoid being tested. There was even a situation where people were lying about their contacts and all of that. So I assume to probably in their minds save their friends and family members from isolation. Because when you get to the bottom of it, people avoid being tested because they don't want to turn out to be positive, because primarily they are afraid of being isolated or being in a quarantine facility. How do you communicate to these people who might be fearful, who might not want to be away from their family, who might not know who will take care of their children, and they're saying, listen, I prefer not to know, I will fight this thing off rather than go to the hospital and it turns out I'm positive?
Well, the thing about it is that you may be fine, and it again goes back to community response, community collective responsibility. See, if you living in a house all by yourself and you get COVID and you're fine and you're working all by yourself and you don't interact with people, then fine, sure. You may not need to be tested. If you do get it, you may be part of the 80-85%. That is fine. That is good and well for you. But you have to also remember that many of us do not live in a situation like that. Many of us do live with people, and particularly we live with older people, particularly we live with people who have comorbidities, meaning people who have other illnesses. So even though you are thinking for yourself, that may not be an issue for you. You have to consider the fact that you are not living in a world by yourself, and that we need to be careful, and we need to be our brother, sister, mother, father, everything keeper in a situation like this. What you're recognizing, though, is that many countries are realizing that because of the large volume of people who contract COVID-19, they are beginning to move away from the idea of isolating everyone who gets sick. And what they're doing now, even in Trinidad and Tobago, what we're doing now is having people isolate at home. So we send you home, have you monitored, and now they're doing oxygen monitors. I can't remember the official name of it. And
Oxygen
calling you
saturation.
calling you every day and saying, how do you feel? But when we're doing that, we're sending you home with instructions that basically says, even though you are home, you still need to be by yourself. You still need to sleep in a room by yourself. If you are interacting with your family, you still need to put on the mask. If you are using utensils and so forth, you need to use the utensils and not share with other people. Your family still needs to do sanitizing like there is no tomorrow, because we have gotten to the point where the numbers are so large that we really cannot keep isolating people in healthcare facilities, because we have to leave those healthcare facilities for the people who really are sick, for the 15% of the people who really are sick and need critical medical care.
What do you think has saved us in the Caribbean from having those numbers that we've seen in the US and Brazil and other parts of the world?
I personally think two things. One, I personally think that we have not been testing enough, so we really don't know our numbers. We don't know. And the other thing is, I also believe that our traditional ways of eating and drinking, and even, we have the trumpet bush and all of those things that we use here. Those things may actually be helping us with the symptoms or helping us to recover, and we don't even know because they are such a normal part of how we live normally in the Caribbean. So I think it's twofold. We don't know because we are not testing enough, but we may also be getting saved by our traditional cultures and some of the things we eat and how we interact with each other here.
And that was actually my next question to Dr. Max, because I know in one part of Guyana, for example, this community was pretty much being devastated by the coronavirus, and all of a sudden, nobody was testing positive anymore. And I think the news interviewed some people within the community and said, "Well, what did you do?" And they were convinced that, listen, we use our traditional medicine and we exercise, and that solves the problem. And I'm seeing more and more people, even in the US, trying to source all the fever grass and lemongrass and all of these things to say, listen, we could deal with this virus on our own. Dr. Max, from a medical perspective, how do you respond to that? What do you say to people your patients, who will say to you, listen, we could handle this thing based on our traditional methods, our traditional
Yeah.
approaches?
Basically, even with conventional medicine, there's not an agreed standardized protocol for the treatment of COVID-19. We really don't know precisely and definitively what definitely works. A lot of things have been tried. Okay, antiviral medicines have been tried, anti-malaria has been tried, zinc and other things have been tried, and people have said steroid works. So different things are being used, and different people are advancing different things. Now, the use of traditional medicine, I'm not too sure because there's no scientific basis for me to talk on that right now. There's some that may work, maybe because that is just our lifestyle. I have also spoken to people in Africa who use a lot of traditional stuff and they believe it's working for them. So a lot of them may not want to go to the hospital. And for example, in Nigeria, it's a malaria endemic community, and they use a lot of anti-malaria for every little fever or anything that comes their way. And the mortality rate has not been that drastic. So we really don't know exactly what it is. However, because of our way of living, we tend to be a little tougher, seems to have more immunity that is more solid because of all the other things that we do, physically active, use a lot of bush, use a lot of this. People can argue that is what is helping them, but we cannot say definitively now that this is exactly what is happening. There may be anecdotal evidences about, okay, this is helping this community, this is helping that community. I look at a chart yesterday. When COVID first started, Nigeria had a very rapid rise, which is not very rapid, but very slow rise. And all of a sudden, South Africa just overtook everybody. And now the mortality rate in South Africa is close to 67, and Nigeria had about 32%. You understand? So we're trying to find why the disparity, because they have now more cases, and Nigeria is just basically just going about their normal way now. And some people have this, strange impression that COVID is a disease of the bourgeois and the people who fly plane and who come into the country. The local people in the villages don't even know what COVID is because they live in normal and they're okay. My mom live in the village and they don't know nothing. They go to church normal, they do everything normal. It's only people in the city and the politicians who are dying of COVID in the city. So everybody has different concept about what is going on with COVID. And until we understand and we are able to see what exactly works, and we also have a lot of conspiracy theories out there.
Yeah.
Correct,
And that is
correct.
killing a lot of people. So we have 5G theory and we have this billionaire who is trying to do this, and everybody is just mixing up everything. I mean, you read some real serious conspiracy theory sometimes, and you yourself as a medical person, you almost feel confused that okay, and then you see some religious people say something. I got something yesterday that was so confusing to me as a medical assistant. I had to send it to my bishop and say, Bishop, check this out for me. What do you think about this? Because the person was so convincing in the articulation of this conspiracy theory that I was getting confused myself. So I had to think, look, I need some spiritual, insight and interpretation of what this is. And then he called me back and said, okay, so these are to look at it and whatever. So it's a lot of things outside there, and a lot of people are confused about so many things. And we need to be careful until we know certainly what is happening. I don't think we can make any certain pronouncement. Like in any ailment, you have the medical, conventional medicine. Obviously, you also have the traditional thing that helps, I mean, I treat diabetes all the time. There's a conventional treatment for diabetes, but there's some people who tell you, hey, I don't take this, but this herbs and this is what I'm using and whatever is happening. So I allow for some of those arguments and those because we don't have all the information and all the knowledge, and we keep learning every day, both from our patients and from everybody else that we can learn from about it. So it's still early days yet with COVID. We're learning and we continue to learn.
We have about 50 minutes or so to go. So if you're watching and you have a question for the panelists, now is a good time to type those questions in, and we can throw it up on the screen and we can get them to answer. They've been doing an excellent job so far, and you can give them more difficult questions. I'm sure they can handle it. So do that now, and let's ask them those questions. Dr. Max, let's talk a little bit about management of yourself. Let's say you realize you're having some symptoms. Yesterday, I was actually talking with somebody who said, pray for me because I think I'm sick. And I said, well, what are the symptoms? And he said, I have runny nose and coughing, but I said, well, you should go get it checked out. He said, well, I'm saying, but it's even from a spiritual perspective, it is better to know what you're praying about. All right. And I'm saying, well, go get it checked out, do the test. I mean, and this is a reality of many cases where people tell you, a colleague of mine said, I'm sick. And I said, well, go to the health center, go get yourself tested. And she said, no, I'm not going because I don't want to go and those people tell me I'm positive. Another friend of mine said the tests are being mixed up, so I'm not going to go because I can't vouch for the results. So maybe they might tell me I'm positive and I'm not. What advice do you give to somebody now watching the program, or it may happen next week, and you realize I'm having some of these symptoms that are associated with the coronavirus disease, Dr. Max?
All right, like any other disease, like I always say, I mean, COVID is just one of many diseases, and we need to see it as that. We need to separate fact from sentiment and fictions, okay? There's some people, since we're talking from the religious part of it, and I tell my patient this, there's a difference between faith and foolishness. If you're sick or you have any medical complaint, you need to deal with it from the medical point of view. There is absolutely nothing wrong in exercising your faith, in you trying to, believe God and trust God and be able to be healed from God. That happens. However, the medical, provision is made for you so that you can, be able to access medical care and treat something that needs to be treated, take precautions, take preventions and stuff like that. Like I always tell some of my patients, I say, listen, there's a reason the same Jesus that we all, pray to, Jesus recognized the importance of doctors in his ministry. And I think he dealt with at least one or two of them as his follower disciples. All right. That means there's a role for doctors. And one of his sayings, those that are sick need not to see the physician. That means, those that are not sick do not need to see the physician. So that means that people who are sick would need the physician. Right? So there's time that you will need the physician. If you are going on the highway God forbid, and you get into an accident and you broke your leg, are you going to go to your pastor and be praying for him to pray that your fractured leg be healed? Or you will go to the emergency room, let them take an x-ray and put your leg in a cast and get it fixed? So we need to, more or less be rational in our dealings, in handling some of these health situations. I've seen somebody who said they trusted God and there are things that they could do and they refused to do it. And unfortunately, they died, and we have people like that, strong in faith, yes, but some of the decision making may not be the correct one. So there's need for you to exercise common sense if you're sick, to seek medical help, in addition to your spiritual inclination, trusting God and believing God, and the role of the pastor and the role of your faith in Christ to heal you as a Christian. But do not ignore the medical thing that has been provided for you to get tested, to get investigated, to get professional advice if you need to lose weight, if you need to avoid drinking, if you need to do the basic things that you could do that more or less, what I say, how you say, do you say it again?
Your English failing you, Dr. Max.
I can't get the right word out, It complements your faith, basically, That's basically what it is. Complements your faith. It does not take away from your faith, but complements it.
Right. I have two questions here. The first one is from Randy Regis. And this says, would you advise that persons boost their immune system? And if so, how?
All right. We should at all times do things that will boost our immune system. Okay, by eating healthy. This is very important. Exercise, very important. Sleep, very important. So those three components, they are very good and effective way of boosting your, immune system. And also some of the supplement that we take, okay, vitamin C, zinc, selenium. There's some other things that that some macro and micro elements that you need to boost your immune system. But most importantly, a balanced, healthy meal, a good sleep, a healthy exercising lifestyle is very important to boost the immune system all year round, not just because of COVID, but because of every other type of diseases that may present.
Sure.
All right, we have another question. I think it's from Alvin Devines. Why are persons after post-quarantine not required to swab again before they go back to their regular settings? And this is been said to be the new protocol now. Why? I don't know if you want to take that, Dr. Max.
Well, I'm not too sure about the protocol to which he's talking about right now. I don't have not seen that. But I know before you are discharged, especially from a government facility, you need at least 2 negative tests that, taken at least 24 hours apart, before you are discharged. Right?
Well, actually, sorry, let me just cut you there because I don't know if that individual is from Guyana, because I know in Guyana the new protocol is that they're not doing a follow-up test anymore, because the concept is that based on the new guidelines, I'm not sure, I have to do some more research on that. I think it's a WHO, but the government has decided that after a particular period, you're no longer able
if
to
after
try.
a period that they no longer feel you are effective anymore, I think I saw something vaguely like that this week that the WHO gave out.
So in Guyana, especially if you're asymptomatic, you're not going to get a follow-up test.
Well, especially if you have to talk in economic terms and the resources are limited and you have to rationalize, then if that is the case, you may not need those kind of tests, because right now, doing more tests means that you have more resources expended. And therefore, you might need to now make some decisions in terms of who you test and how frequent do you test people.
Now, there's also the person used the word quarantine, and I'm not sure whether they mean quarantine or whether they really mean isolate, because quarantining is what you do to well people who have been exposed, but you're not sure that they have gotten infected. Versus isolation is what you do with people who you know are sick, they have been tested as positive, and you're keeping them separate. So again, it goes back to whether we're using the correct terms. And yes, Dr. Max is 100% correct in terms of each government needs to decide how it uses its resources, and what it chooses to prioritize on, because the tests are expensive. At least the ones that we are using now are expensive. There are newer tests coming out that seem to be a little cheaper, but those aren't widely used outside of the United States and outside of Europe right now. So it may be an issue of cost.
Yeah, I mean, and it's as you rightly said. I mean, it's a decision really that the government has to make, and of course, the citizens will have to understand, because I know in many cases in Guyana, for example, the system is so clogged that if you do a coronavirus test today, you're not likely to get the results until probably a week from now, 7 to 8 days, because it's such a great backlog. And of course, now you, as a government, you or the managers of the healthcare system, you will now have to make a decision. Do I keep testing everybody? Do I keep doing 2 tests, or do I move forward and identify those who we don't know about?
Yeah.
Um, let me just continue with you, Dr. Brebner. I know we get into wrap up time now, and I want to talk a little bit more of management of this virus at the more community level, in the villages, and even at the government level. I want you to talk a little bit more to the viewers, to people in the community, the boys on the street. Um, Talk to them more specifically in terms of why should they be paying more, giving more significance, sorry, at a senior moment there, giving more significance to this virus, and why is it that they should not take it for granted?
Well, the reality is that we don't know enough about this virus to decide whether we should take it for granted or not. We simply don't know. A lot of the data is showing that if you are younger, you seem to be faring very well. But the reality is, we are finding people who are very young who are having significant heart issues with this. Uh, Children seem to be faring okay, but again, there are instances where children are coming out with what is known as a Kawasaki-like type of disease, where we are seeing that children are not doing well. The reality is, we don't know enough about this to decide whether we should take it seriously or not. We can't make that decision just yet because we just don't know. And unfortunately, even though the numbers seem to be very small, even though the percentages seem to be very small. So when you talk about the percentage of people who have died, and we're talking about, 1% or 2% or those kinds of numbers, that may not seem like a lot. But if that 1% or half percent is my grandmother, this is a huge issue. It's a huge issue for me. And you have to consider that it may not be a large number overall, but I don't want that one person to be my grandmother. And you should not want that one person to be your grandmother either. And even again, going back to the small numbers of young people who are having significant heart issues, you really don't want that one young person to be you, because you think that you are too young and it's not happening to people. We just don't know enough about this. We need to wait out a little bit. We need to make sure that we learn more. We need to follow the science. There are tons of research happening now, and we need to continue learning about it. And in a year, 2 years from now, we can say, oh, well, we survived, we're fine. But until then, I am personally not one to risk it. And I am hoping that other people feel the same way, that they are not willing to risk it because the risk is too high, given what we know, but more importantly, given what we don't know about the virus.
In addition to that, I don't think this is a virus that we should take lightly, because across the different age strata, it's affecting practically everybody in different ways.
Mhm.
As you say, with the children, you have the Kawasaki, the heart disease type of ailment that they come with. And then in the younger age group, which is really between the teenagers and around 40, a lot of them are coming down with strokes.
Mm.
In the above 50 and 60, there are a lot of morbidity and mortality as related to people with chronic diseases. Now, there's still a bunch of um, researches out there that is pointing out that there's a lot of long-term complications of COVID, which involve not only heart disease, it affects your brain, it affects your kidney, it affects your skin, and there's so many other things. Last week, I was reading something out of the UK that actually affect the male sexual function as well. You're not too sure the mechanism by which it happened, but some of the viruses have been isolated in semen. So there are quite a lot of things that are going on right now, and the complications are just diverse and not fully understood. So it's not something we should joke with until we know. Even if we know, it's still not something to joke with.
Yeah.
All right, let me just run this comment very quickly. I think this is going to be our last comment for tonight. 2 nights ago, I heard a female doctor say that the virus is affecting the blood. She and her team are carrying out an investigation, and they discovered that it attacks the blood. Do you have any information to validate this, Dr. Max? Or
I don't have any information to validate that. However, it is not far-fetched because certain viruses could cause, mutations in different ways and could affect or exposes your risk. Like certain viruses may increase your risk of cancer, or either cancer of the blood or cancer of other places. So since it's a poorly understood phenomenon by now, we don't know what is out there. We really don't know. So I will not be surprised if there's a researcher tomorrow that's okay, look, this virus could trigger leukemia or it could trigger something else, whatever, because some of these ailments and diseases do have the increased risk when exposed to certain type of viruses.
Yep.
right, I think we just there about wrap up time. Before I ask you to give your closing comments, let me just throw in a little public service there for Tobago Inspirational Network. For those of you who are in Tobago, of course, you can get TIN on the Trico Network, channel 137, and in Guyana on the Atlantic Cable Network on channel 2. And if you don't have Trico, you can always download the app. It's on the Tobago Inspiration Network on Google Play, and you will have access to the channel 24 hours a day, anywhere in the world, any time of the day. Of course, there's a live tab on the app that you can just click and you can watch the channel. And of course, there's also a website, tin137.com, that you can click and you can see all the past programs as well as a live stream 24 hours a day of the channel. So if any reason you don't have Trico, you should, or you don't have it, then you still have access to the channel at your fingertips. And of course, for those of you who want to give to the channel, because giving helps to keep us on air. There's a tab on the website, tin137.com. There's a tab that you can just click and you can give using your credit card. And of course, there's a PayPal option if you have the paypal.me/TobagoIN. You can use that option as well. So I just want to encourage you to make sure you download the app so that you can follow the Tobago Inspirational Network anytime that you so desire. But I just want to thank you so much for being a part of the program. Before we go, Dr. B.Yisrael and Dr. Max, anything you want to add in closing? Let me start with you, Dr. B.Yisrael, and then we're going to come to Dr. Max.
Sure. I would just like to reiterate the fact that we need to be our brother's keeper. We need to ensure that when we act responsibly, not just for ourselves, but we act responsibly to ensure that our entire families or entire community is safe. That is the essence of public health. That is why we need you to wash your hand. That is why we need you to wear the mask, even though it may not be the most comfortable thing. That is why we need you, particularly if you're not feeling well, if you have the flu-like symptoms, to stay at home. And depending on where you are in the world, call the numbers, let the medical people give you the advice that's necessary. We can't be selfish about this. This is a situation that has the potential to cause significant harm to our loved ones, to cause significant harm to our neighbors, our brethren in church, and so forth. We can't afford to be selfish about this. So that means each of us needs to be responsible and each of us needs to follow the guidelines that we have been given. I'm just letting us do that. Just collectively follow the guidelines, because you're not just responsible for yourself, you're responsible for your entire community.
And before Dr. Max jumps in, let me just add to something to what Dr. B.Yisrael said there just now. Particularly for the church goers, I know that we're accustomed hugging and being in close contact and all of that with each other, but we still have a responsibility to follow the guidelines. I tell people at church now we just have to do a virtual hug, because that's the state that we're at now. And while we all believe in the healing power and all of that, you still have to, as Dr. Max said earlier, you still have to use wisdom. I tell people, you don't say the blood covers me and walk across the highway and assume you won't die, because you will die, right? And it's the same concept that you apply, the same principle that you apply in managing this coronavirus disease, because you now have to use wisdom. If you happen to be somewhere that you still have church and you go to church, keep your physical distance, just as you're doing at work or in the supermarket. Sanitize, keep your mask on, and do all that is necessary to protect yourself, because even as Dr. B.Yisrael said, you might be okay, but you might take the virus home to your sick mother or grandmother or somebody else home who might not be able to withstand the viruses you are. So, Dr. Max, I just did that as a little prelude to you, but you can jump in there and round up.
Basically, my closing remark will be in the line of encouraging the population. The government will be doing whatever they could do in different jurisdictions, be it in Guyana, Jamaica, Trinidad or whatever. But there's just so much that the government could do. There is also the responsibility on the citizen to also take responsibility for themselves and try to comply and obey the regulations and the guidelines to minimize the spread and the contraction of this virus. This is not just about you alone, like Dr. Faith said. It's about every other person on your job, in your family, in your church, or whatever. And if we continue to be careless and do things erratic way, and we think, okay, well, we have a right, you will be dead having a right, because if you break light because you think you have a right of way because there's a light that you're going through, you get into an accident and die. Basically, the same thing. You could be, it's your right not to wear masks, it's your right not to do this, but it to be your right to get infected, but it's not your right to infect somebody else. So you have to try to, be sensible in your approach and deal with this situation as it is right now. This is not the first time the world will go through a pandemic. In 1918 or 1920, there, about 100 years ago, it happened. The same measures, the same kind of situation took place. And luckily now we had the advantage of technology that things did not come to a standstill like it would have then. So let us try to, be sensible and support the government effort wherever country you may be, and not overwhelm the health system, because that is the major risk. Once you overwhelm the health system, you're going to have problems. The people who need the help cannot get it, and then you're going to have a lot of mortality and morbidity that the government cannot cope and cannot afford.
All right, thank you very much. Of course, time would never permit for us to have to discuss all that we can about COVID-19, but I thank you. I think you were able to deal with it, both of you, very comprehensively this evening. And I want to thank those who tuned in this evening. Next week, we'll be back again, of course, with a different panel. And next week, we'll be back to a part 2 of a discussion we started about 2 months ago, which had to do with marriage. And that part 2 was promised, and next week we're going to have a competent panel as well, talking to us about marriage and how to hold it together and avoid it getting to the state of divorce. So you want to tune in again next week, 8 p.m., right here on the Tobago Inspirational Network Facebook page and YouTube channel. And of course, you can, I've seen many people go a week and 2 weeks after and still commenting on the programs that we've done on YouTube and on Facebook. You can do that, and if there's a question, you can also inbox us and I can get it to one of the panelists and they'll be able to respond directly. And if you need to get in touch with a panelist, you can also let us know, and we will forward your information to them, and they will make contact with you. So next week, same time right here, I encourage you to tune in and be a part of that discussion. Once again, Dr. Maxwell Adeyemi and Dr. Faith B.Yisrael, thank you so much for being a part of this program. Good night and enjoy the rest of your weekend. Bye for now.
Thank you.
Thanks.